Hi, I'm Kristen Hamilton, and I am a vocational rehabilitation counselor for VCU's Rehabilitation Research and Training Center.
Hi, I'm Bethany Moog-Ayers, and I am a vocational rehabilitation counselor with VCU's Rehabilitation Research and Training Center.
Today we're going to be talking about disability etiquette. We will be providing some general tips on how to demonstrate understanding and respect within your interactions with individuals with a disability. So what is disability etiquette? Disability etiquette refers to being respectful in your interactions and communication with or about people who have a disability, regardless of who's present for the conversation. Also, disability etiquette is not about the disability. We want to emphasize putting people first and before the disability and interacting with individuals with a disability in an appropriate way. Disability etiquette is also having an understanding that everyone is different and so are their needs. Also, being open to learning more about disability culture and ways to promote equality and inclusivity among those with a disability and without a disability. Here we have a list of some disability etiquette fundamentals that we will be talking about more in depth, and they are person-first language, avoiding outdated language, conversation courtesies, ask before you provide assistance, do not make assumptions, and ask questions when you are unsure.
Person-first language is an essential component to helping the person you are working with feel seen and respected. These are a few essential components to using person-first language. Refer to the individual first, then his or her disability when it is relevant and appropriate. The use of person-first language recognizes that individuals are more than their disability, which promotes equality for everyone. Use preferred language of the individual if specified. For example, some people with autism may prefer to be called autistic. Only use autistic if the person that you are working with has told you that that is what they prefer. Examples of person-first language. Person with an intellectual, cognitive, developmental disability. Notice that I said with and not is. Person with a mental health or a psychiatric disability. Person who is hard of hearing or is deaf. Person who has vision loss. Person with a physical disability. You'll notice in the third example that the D in deaf is capitalized. This is because deaf with a capital D refers to embracing the cultural norms, beliefs, and values of the deaf community. However, when you see deaf with the lowercase d, that is specifically referring to people with hearing loss. It is important to note the difference between these two.
Avoid using outdated language. So do not refer to the person based on their disability. For example, avoid saying she is a paraplegic. We're not demonstrating person-first language in this sentence. Avoid using negative and disempowering words such as victim or suffers from. Avoid portraying those with a disability as brave or as an inspiration. Although it may seem like a compliment, it can also be patronizing. Avoid using the term normal to describe somebody without a disability. Simply say person without a disability or neurotypical if it is necessary to make a comparison. Also, avoid using outdated and inappropriate terms to describe a person's disability or somebody with a disability. Here is a list of inappropriate terms with their corresponding more updated and appropriate terms. So instead of referring to somebody as the disabled or handicapped, you would simply say individual with a disability. Instead of saying somebody that is mentally challenged or slow, you would use to describe them either an intellectual disability, a cognitive disability, or a developmental disability, depending on their diagnosis. You would not refer to somebody as crazy or mental. You would use the mental health disability in efforts to describe their disability. Instead of saying wheelchair bound, you would say person who uses a wheelchair. Instead of saying hearing impaired, you would say hard of hearing or deaf with a capital D. Instead of saying the blind to describe somebody with vision loss, you would just simply say person who has vision loss.
Conversation courtesies. I'd like to start by saying the more comfortable you are, the more comfortable the person you are working with is going to be. A few things to keep in mind when thinking about conversation courtesies. It is okay to initiate greetings as you normally would. For example, a handshake. Always speak and direct questions to the individual, regardless if there is a companion, job coach, or aide present. The person that you are working with is the most important voice, and you should make it known that you are showing them respect and listening to them, showing them active listening skills by speaking directly to them instead of to the person with them. Make eye contact and demonstrate appropriate body language toward the individual. It is okay to use expressions such as "see you later" or "did you hear about this?" as it is common phrases that everyone uses, including people with disabilities. Always ask before you provide assistance. You want to be really careful not to make assumptions about what someone does or does not need your assistance with. Respect the individual's independence and autonomy. Do not assume that you know what the individual needs help with, as mentioned before. Always ask the individual first before providing assistance. Clarify what type of assistance is desired. This taps into the need for constant communication with the person that you're working with and always asking before assuming.
Do not make assumptions. Every person and every disability is different. Do not assume that people with the same diagnosis have the same strengths and the same challenges. Avoid assuming that somebody with a physical disability also has a cognitive disability, and vice versa. Do not make decisions for the individual about their ability or their desire to participate or complete any activity. People with disabilities are the best judge of what they can or cannot do.
Always ask questions when you are unsure. Respect the privacy of the individual and avoid asking about their disability unless you have established rapport. If you are ever unsure of how to proceed with an interaction or communication with an individual, it is okay to ask for clarification. In fact, it's really important to cater your teaching and learning skills to what's most accessible to the person that you are working with. It is okay to ask the individual if they have a preference in how they like to do things. For example, they may have a preferred communication style or learning style. Utilize resources available online to learn more about the various appropriate disability etiquette strategies that are specific to a disability.
Promoting disability etiquette in the workplace. Good disability etiquette can help to expand business opportunities and help organizations to serve customers more effectively, as well as their employees. Disability etiquette includes strategies that will promote an inclusive work culture. Disability etiquette also aims to allow all employees to feel comfortable and productive in their work environment. Knowing these general tips and having these strategies can really help to create a more cohesive work environment among those with disabilities and those without disabilities. Share the facts and the fundamentals about disability etiquette with others who are not as experienced, whether that's in the work setting or in a personal setting. Reach out to support to a supported employment agency to learn more about ways to successfully integrate individuals with disabilities into the business or organization. If you have any additional questions, please message us on our web board. Thank you.
Thank you.